Up next, we have another power-packed keynote presentation on transforming lives of patients with telehealth by Dr. Saurabh Chandra, the Chief Telehealth Officer, University of Mississippi Medical Center, USA. I welcome Dr. Chandra to deliver your keynote presentation, and the stage is all yours.
Good morning, and thank you for the invitation. It's a pleasure and honor to be here in this forum. I had, the earlier speaker, Dr. Khalid, that was a great talk and resonated a lot of things that we are doing here in the United States in the area of telehealth. And it's really reassuring that the global audience is thinking about telehealth in the same way. So my topic for today is transforming lives of patients with telehealth. And I'm just going to share my presentation, go through my slides quickly and take any questions if there's time at the end of the presentation. I have no disclosures. Just wanted to quickly touch base on different telehealth modalities. During the pandemic, most of the telemedicine was done in the ambulatory space, utilizing audio-video visits. But that's not all. I think telehealth, as the previous speaker mentioned, has many other modalities. There is remote patient monitoring. I'm going to talk about it a little bit. There is also store and forward. You can take a picture of your lesion and send it to your dermatologist. That's asynchronous store and forward. And also providing health education and empowerment to patients to take care of their own disease states. And that all falls under telehealth as well. So when we talk about benefits of telehealth, I put it in 4 buckets. That's called the quadruple aim. And there are 4 components to that: patient satisfaction, provider satisfaction, clinical outcomes, improving them, as well as financial return of investment. So if you think about putting a program together, you should always think about these 4 buckets. Are you able to improve? Are you able to impact these 4 buckets? And if the answer is yes, then I think you have a good program that you should be able to implement and monitor and demonstrate value. So I am speaking from the United States here in the state of Mississippi at the University of Mississippi Medical Center. We have a very rich history for telehealth implementation. Mississippi is a predominantly rural state. We have been early adopters of telemedicine, and we started our telemedicine journey way back in the 1990s. And during this journey, we started first with some tele-emergency medicine consultations. All of that folded under the umbrella organization in 2013 called Center for Telehealth. And then we are recipient. We are also now, since 2017, considered Center for Excellence for Telehealth by the federal government that allows us to receive some funding that we can use for implementing novel programs. This is our footprint in the state of Mississippi. On the right side is our state with the counties designated. And the blue ones are the ones that we have our footprint of telehealth with only a few counties left. And I'm happy to know that we are rapidly expanding since the pandemic. And this is where our story begins. And this is why we are here today. I think in every state in the United States and every country during the current pandemic, we have seen an exponential growth in the telehealth. And this is no different for our telehealth program here at University of Mississippi, where we saw in 2019, less than 20,000 visits per year, jumping to almost 134-fold increase in a matter of few months. And the question for all of us today and why we are here today is where we go from here. Because yes, telemedicine helped to bridge the gap during the pandemic. And we have seen the value for telehealth. But the question is, where do we go from here? How do we, sustain the growth in telehealth? How do we deliver the promise of telehealth so that our patients, providers, all stakeholders continue to benefit from telehealth? And we started thinking about this a little bit early in 2021, and I wanted to share with you our framework for implementing telehealth programs, and it will resonate with some of the points that were addressed by the previous speaker, Dr. Khalid. So number one, you need to integrate with your existing care delivery model. It should not be a standout model, should not be practicing in silo. You should understand where the gaps are and understand how to bridge the gaps with telemedicine. So it should not lead to fragmentation of care, because fragmentation of care would not lead to good overall care for the patient, because that would not keep primary care physicians in the loop, would not lead to coordination of care. So you should identify the gaps that the existing in-person model has and try to bridge those gaps using telemedicine. And as the previous speaker mentioned, you should not be thinking about substituting care, but augmenting and enhancing care. And most importantly, telehealth programs should create and demonstrate value for multiple stakeholders. And it should transform care across the care continuum. So what do we mean by care continuum? If you look into what the definition of care continuum, it actually means different things for different stakeholders. It means all settings, and all settings mean delivery of care in different settings, from home to inpatient to outpatient, for all types of care, preventative, maintenance, hospital care, and especially to all age groups. So when we think about care continuum for telehealth, it should encompass everything. You should think about a comprehensive telehealth strategy going into the future that should deliver and bridge gaps in the existing care in all delivery settings, deliver all types of care, whether it is maintenance, preventive, or acute care, and should be should be giving benefit to all age groups. And this is what we speak when we speak about care continuum and telehealth transforming care across the care continuum. This is what I mean. And I'm not going to go into this slide. This is a little complex, very busy slide, but what it shows is that you have, you go through your life cycle, and during each life cycle, you receive care in different settings, whether it's hospital, primary care physicians, home, school, and you can set up different programs into each into all these different delivery settings, and deliver different types of care. I'm going to just go through a few different programs in the last few minutes that I have, and then talk about what you should be thinking about when you are trying to implement a telehealth program. So first of all, maternal health, you can think about different ways. That's where life starts. For pregnant females, you can deliver care right at home, provide education modules. If they're living in rural settings, you can provide telemedicine consultations at home. You can provide specialty telemedicine consultations at the primary care physician's office, delivering better care, increasing outcomes. Pediatric health, they receive care at home, school, specialty consults, inpatient consults, but a huge need is delivering care in the schools. And I'm happy to report that here in UMMC in Mississippi, now we are setting up one of the largest school-based telehealth programs, delivering urgent care and behavioral health right in the schools, trying to prevent absenteeism and improving outcomes and improving academic performance for the students. For adults, again, you receive care at home. Now, direct to consumer, urgent care, you can provide delivery at home, reduce hospitalization, reduce ED visits. You can deliver all kinds of telehealth programs right to the primary care physician's offices, augment care that is being delivered there. And of course, inpatient, like there are a variety of different programs that can be set up. I'm not going to go through all of these, but definitely want to mention remote patient monitoring program. There is an epidemic in the world on, about chronic diseases like hypertension, blood pressure, diabetes. And I think we have with telehealth an opportunity to manage chronic diseases. And remote patient monitoring is basically enabling patients to take their biometric data at home using Bluetooth-enabled devices, receiving that information by the virtual team, and providing support management, medical management to the patients at home. And we have seen this program lower hemoglobin A1C, lower blood pressure in patients that are being followed through remote patient monitoring program. And I think every telehealth program that is being implemented should think about remote patient monitoring, because I think that's going to be a standout signature program impacting healthcare in the future. And how do we put all of this together? I think very important to create the right clinical team. If you don't have a right clinical team in-house, then you should collaborate with other organizations. There's no geographical, constraints anymore with telehealth. Of course, you have to worry about the regulations, but I think setting up the right clinical team, whether in-house or by collaborations, is very important. Second thing is trying to find the right platform, having a good long-term strategy. Providers don't want to get into different EMRs, different platforms. So one strategy as far as possible that can be utilized for different programs is very important. And last but not the least, think about data. Think about how you can use the data, because telehealth, especially remote patient monitoring, will be generating a lot of data. And there'll be a wealth of data that can be utilized, for example, developing training programs for machine learning, AI programs. There could be a lot of training data that can be used to develop these algorithms that can further enhance the care that we bring through telemedicine. So those are some of the things that people should be thinking about when setting up telehealth programs. And I'm going to stop here and take any questions.
Thank you, Dr. Chandra. In case there are any questions, like we do, we would go ahead and send them to you and you could answer them. All right?
Thank you.
Thank you.
Humanity, rising to the challenge of a lifetime. But we're not done yet. Better has just begun. Let's make healthcare reach everyone. Let's push this world forward, because together we make life better.
A beautiful message from Philips there in their advertisements, right? Thank you, Dr. Chandra, once again for the insightful keynotes. I'm sure our eminent delegates have benefited from your enlightening speech. Thank you once again, and hope you have a great rest of the day. I'd like to remind all our dear participants to visit the booths of our platinum sponsor, Philips, and our gold sponsor, Advanced Care, and see what they have for all of you, right?